Hi, in today's video, I will discuss my process for taking on a new client. It is important to note that the most important part of the therapeutic relationship and any benefit that a person will get from therapy is that the therapist and the client have a good bond with each other. So to me, that's important. I will actually not take on somebody if I don't think that I can be the best person for them. And if that happens, I'll work to find them a replacement therapist or somebody else that can meet their needs better than I can. So the first thing that I do is schedule a 10 or 15-minute phone call with the parents of the person that I'll be seeing, assuming that it's a child or a teenager that I'm going to be taking on as a client. This gives me a chance to talk to the parents without the child being present, so we can have an open conversation as to what they're looking for. If that goes well, both from their perspective and from mine, I will then offer a 30-minute no-charge in-person consultation. So this is done in the office, where I will meet one-on-one with the child to get the sense from them what they're looking to get out of therapy. If after the 30 minutes, I ask them if they want to continue. If they do, then that's great, and the initial session is effectively half price. If they decide not to, and that can happen as well, then there's no charge for the 30 minutes, and they can go home and talk to the parents about whether or not they think it's worth proceeding. Because again, you want to make sure that the therapist that you're working with is somebody that can offer you the value that you think that you need. Once I'm meeting with a client, very early on, I want to find out what their goals are. So these are therapeutic goals, and we try to get it down to something specific. So if a person says, I just want to feel better, I try to help them define what does feeling better mean. I also, and this is I think somewhat unique in my approach, try to find out what they do for fun. Fun is an important part of life, and even when a person has a mental health challenge, they still do find ways to enjoy themselves. With whatever I'm going to recommend, the chances of being successful are improved when it's based on something that they already enjoy doing. So again, it's very important for me to find out what they enjoy, what they do for fun, in order to help make good recommendations for them in the future. Finally, what I do is I review my approach with them. In a previous video, I discussed cognitive behavioral therapy and how that works. And what I do is I review both visually as well as with my words what CBT does, how it operates, the way that I use it, to make sure that they're comfortable with the approach going forward. It's very important to note that no matter what I do with my client is the one who decides if it's a process or a technique that we follow through with and use. It's very important for my client to know that they're in charge, that whatever approach we're using is something that they agree with, that they think they're going to get value out of in order for it to be used in a session. And if they ever decide not to continue with that type of approach, we stop and find something else. Finally, I like to use a lot of humor in my sessions as appropriate, as well as what's called active listening. Active listening is a very important skill for any counselor or therapist because it means that you're listening to your client talk without having any preconceived notions as to what they're going to say. This is important because a lot of times people are thinking about their response while somebody else is talking, which means that their effectiveness has gone down. So again, for me, active listening and humor are very important. Thank you very much for your time. If you have any further questions, please call me at 416-613-1259 or email me at kevin@hhcw.ca. Thank you.